Let's talk Invisalign and maybe the difference of Invisalign versus the old braces, maybe the difference of Invisalign versus the Sure Smile. But mainly tell us of how Invisalign work and for whom they are pretty damn good, a good option to do.
As I've said before, I was one of the first 25 trained in the country, and I knew the people actually that had even invented it. It really is more or less a way of positioning teeth incrementally from where you start to where you're going to end up. And for each step of the way, you make a clear aligner that fits over, so you change things step by step. With braces, there's usually not that kind of step-by-step thing, and especially with Sure Smile, we don't need to have steps. We can go directly from point A to point B because of how exacting the robotic wires are. Invisalign works really well for those cases that have a lot of times minor corrections. There are a few of my cases that I did that turned out phenomenal that were really difficult, and there's some that didn't seem to be very difficult, that were very difficult to finish. I would say probably in order to get the kind of quality that I like and what my patients expect as far as exact finishes, I'd say close to half of the Invisalign cases that I did, I ended up putting braces on at the end to fine-tune things. I know the Invisalign people don't like to hear me say stuff like that, but there is a place for it. It is definitely not a cure-all, and in many instances, it doesn't quite give the kind of exactness that you can with fixed appliances.
I see. And when you have younger teenagers who are maybe a little bit on the holodrio slappy side, like I am still at my advanced age, then there's the additional chance that they take it out for lunch, dinner, breakfast, which they should, right? It's a good thing that you can take them out, brush your teeth normally, and put them back in. But then the bad thing is they could possibly stay off for a long time, right?
Very, very definitely. The research with Invisalign, like appliances, and there are a number of other offshoots from it, clear aligner appliances, is that the research shows us that if you leave your aligner out for any more than 4 hours at a time, then the cellular response around the roots of the teeth starts reversing itself, and you almost have to kind of start all over again. It's a very difficult thing to be completely committed and follow the directions exactly like you're supposed to. I did Invisaligns on myself in 2000 after they first came out to see what it was like. And it was not difficult to wear them, but it was difficult to make sure you had them in all the time. It's real easy to forget them and real easy to not wear them. And especially for our younger patients, I always did kind of keep the parents away from that if it was at all possible. I had some of my teenagers that did great with them, but for the most part, it's a hard thing to commit to sometimes.
Well, that's with everything in life. I mean, some people, of course, better at it. Like my wife, whatever she starts with it, whether it's a vitamin regime or something she does with her face or whatever it may be, brushing, for instance, I'm usually through showering, shaving, washing, and she's still brushing. And, she does it religiously. And for people like her, Invisalign would pose no problem at all. For people like me, I can say, not today, I forgot them in the office, I forgot them at home, and doing so, you basically have a huge camouflaged hole. You're making no advancement. I can see that.
Absolutely.
I can see that. In the end, like with economics or whatever, we sometimes don't like the treatment, but liking a treatment and needing it to then have years and years of good life are sometimes two different things.
Yeah, absolutely. The things we do with orthodontics, by definitely improving function, one of the biggest things is that we improve a person's self-esteem tremendously. That's one of the first things that I found even when I was in ortho school. I'd have people come in that were very afraid of their smiles, and they'd talk to you with their hands over their mouth, were afraid to smile. And I can't tell you how many of my patients, when we're all done, you can't stop them from smiling. And their parents and their families are just amazed at the different person that comes out at the other end.
Nothing beats $1 million smile, huh?
Absolutely. Absolutely.
All right.